is coming in 3, 2, 1. Hi, Dr. Thaisa Bordin.
Hello, Dr. Andretti. How are you?
I'm fine. Good to see you here. We are so proud to have you here for this broadcast. Actually, we met Dr. Thaisa, I think it was more than 1 year. But we met personally, it was this January. Is it correct?
That's correct.
That's fine. I went when I went to Boston and I visit her in the university. It was a good time to join you there, being with you there. It was amazing. Let me introduce you, Dr. Thaisa. Dr. Thaisa, she is Brazilian. Dr. Thaisa Bordin received her degree from the State University of West of Paraná in 2011. After she graduated, she completed her certificate in Prosthodontics, and she is Master of Science in Dentistry and Doctor of Philosophy in Dental Science programs at the PUC of Rio Grande do Sul, here in Porto Alegre, Brazil. After that, she was awarded with a scholarship. Actually, during that time, she was awarded with a scholarship during her master's and PhD degrees, which allowed her to become a visiting student for 1 year in the postgraduate prosthodontics programs at Tufts University School of Dental Medicine. She also worked in private practice for about 4 years before moving to US. Don't get me wrong, she's so young, but she rocks. Dr. Thais, I'm so proud to have you here and to say to the audience that today you are assistant professor at the Department of Prosthodontics from Tufts University, where you teach and train full-time predoctoral students in preclinic and clinic as well. Is it
Yes,
correct?
yes, that's right, Dr. Fabio Andretti. Thank you so much for having me.
Yeah, if it wasn't, if it, this all these things were not enough, she was chosen as the secretary for the ADEA Special Interest Group Career Development for the new educator of the American Dental Education Association. So, actually, today you are continuing to conduct research on dental implants and dental prostheses. Is it?
Yes, that's right.
So let me tell you one thing. I graduated well before you. I graduated it was 23 years ago, and at that time I attended to an update course on implant dentistry. It was 1999, and at that time, a research we had to improve the accuracy of implant placement was a cross-section stone model technique where we measured the thickness of the mucosa using a caliper under local anesthesia and transferred the measurements, the dimensions to a model matching to the cut of the CT at that time, to trying to improve the angulation and the entry point of the implant. And we both know that implant dentistry has evolved remarkably since that time, the last few decades, both in the surgical and prosthetic parts. But uh, I I became a fan of your work when I realized that you were working with prosthetic and surgical planning in a digital way.
Yeah,
Uh, could you tell us a little brief classification of these methods?
for implant placement, sure. So,
Yeah,
well, the methods for implant placement include the freehand approach, the surgical guides fabricated on casts, right? And also we can use nowadays the CAD/CAM, the computer-aided design, computer-aided manufacturing guides, the 3D printed ones, for example. And these type of guides, the 3D printed ones, they can be supported by teeth, soft tissues, or bone structures. And there's also nowadays dynamic navigation system and robot-assisted surgery systems.
great. I forgot to mention that this interview will address the points that Dr. Thaisa have had published in our book, I will share with you later the cover of the book, the second volume of Digital Dentistry, New Horizons on CAD/CAM Education. So remember that late 80s, it was the beginning of the 3D era with CT scans. At the beginning of 2000s, it was the beginning of the CBCT technique. But dynamic navigation is relatively common in several areas of medicine, such as neurosurgery and orthopedic surgery. And later on, we've been hearing about these dynamic navigation systems in dentistry. At the end of the day, what are these systems, and are they still prototypes, or are they already a reality in our field?
All right, so dynamic navigation system, they feature motion tracking technology that captures the position of the patient and the surgical drill, providing real-time guidance and on the computer screen. And it's based on information generated from the patient's CBCT scan. When the drill approaches the pre-planned position of the implant, the system provides information on the computer screen to assist the surgeon for navigating precisely to the exact position of the drill entry point, adjusting the drill orientation to the planned angle, and guiding the osteotomy, navigating along the desired path until reaching the planned depth. Once the osteotomy preparation is complete, the same approach can be used to guide the placement of the dental implant as well. And regarding the question about if the systems are still prototype, that answer is no. Actually, as you mentioned, this system have been used in medicine for actually a longer time than dentistry, and they are not prototypes anymore. So we have been using them clinically.
Great. Could you give us some examples of this technology or some of those systems? Could you tell us? Could you show some material?
Absolutely. So let me just let me just show you a few different systems you have available right here.
So we have here a table of some equipment. Is it?
That's right. So a few years ago, me and my team here at Tufts, we did a literature review about some systems that are available in the market, and we realized there are 4 main systems that have been used and mentioned in research as well. And they include the system for image-guided implant dentistry, from Image Navigation. It's a company from Israel. There's also XGuide Dynamic 3D Navigation from XNavi Technologies, which now has a partnership with Nobel Biocare. And there's also Navident from ClaroNav, and finally Alliant from Navigate Surgical Technologies. And these last 2 companies are from Canada.
Great.
And each of them, so we have the Image Guided Implant Dentistry here, IGI from Image Navigation. And as you can see from this images here, this system has a separate card, and on this card has the sensors. As you can see on the image on the right, and actually the image on the left too, you can see the sensors tracking the patient tracker that goes on the patient mouth and the tracker that goes on the handpiece. Here is the system from XGuide Dynamic Navigation from XNav Technologies. It's very similar. It also has a card with the sensors that track the both sensors, the attachment that go to the patient's mouth and the attachment to the handpiece.
So these sensors are tracked through those sensors who are over the patient's and professional head, is it?
That's right. So you just have to position the sensors in a way that it can capture both. It can capture the patient tracker, and also it can track the attachment to the handpiece.
Great.
And these images are from Navident, from ClaroNav. It's the same idea, same concept, the card with the sensors. And in this case, they have a laptop and the trackers, the patient tracker and the handpiece tracker.
Is this a specific laptop or an ordinary laptop? It's sold
I'm
with the system?
I'm not 100% sure about that, but I believe you can use your own laptop. They just have to
Great,
install their software.
great.
That's about it. And these are images from Alliant. So with the same idea as you can see on the image on the very right, we have the card with the screen and the computer that comes with the software. And we have on the bottom here, you can see that Alliant actually has a smaller patient tracker, and also does not have any attachment to the handpiece, has some laser engraved markers on the handpiece. And those are the reasons why we chose to work with this company, with Navigate Surgical Technologies, because we notice they do have a smaller tracker set for the patient, and they also do not have any attachment to the handpiece, which doesn't change the way you hold the handpiece or the weight of the handpiece.
Great. This is the system you described in the chapter, is it?
That's right. That's the system we described on the book chapter.
Great, great. Okay. Let me ask you another thing, Dr. Thaisa. Specifically about the Alliant system, could you share us an illustration of the technique, please?
Yeah, absolutely. Let me go back to the slides. So how the Alliant works, actually it streamlines the workflow, right? Because we have to make the digital plan, and then you can keep all the work digitally. So first of all, we make a stand. The system has comes with some plastic beads that you just put in hot water and becomes like a jelly consistency and like a putty, and you put inside the Alliant fiducial, and you put on the patient's teeth, and the patient takes the CBCT scan, and you upload the file to the Alliant software, and do your digital plan based on the virtual prosthetic restoration, and then we go to the surgery. So you could do all that in the same day.
Great.
So here we have
Introducing Alliant, a dynamic surgical navigation system that offers dental implant surgeons enhanced accuracy and predictability, with all the convenience of conventional freehand implant placement. Here's how it works. The system uses high-definition motion tracking cameras to track both the laser-engraved handpiece and the patient tracker. The software then calculates the drill position and displays it in real time over the patient's CT scan during surgery. The Alliant system does not require a handpiece attachment to effectively deliver the benefits of surgical navigation. Clinicians using the handpiece need not alter their surgical technique, nor is tactile sensation compromised by an attachment. The same as freehand surgery. This patented technology is the first in the industry. Let's take a look at the workflow. The patient is scanned wearing the Alliant fiducial stent, which is fabricated chairside within minutes. Registration indicators embedded in the fiducial are located by Alliant software, which correlates the scan with the patient's anatomy. The intuitive software provides streamlined planning, which facilitates identification of important anatomy and planning of the ideal implant position. During surgery, Alliant shows the drill position over the patient's CT in real time, enabling the clinician to confidently place the implant with sub-millimeter accuracy. The Alliant system for real-time surgical navigation is accurate, user-friendly, and cost-effective. Its streamlined workflows and attachment-free handpiece are a winning combination, delivering a simple and effective technology that will enhance any practice placing dental implants.
Now I'm sure that we can hit the bullseye.
right.
Let me tell you one thing. I was amazing. It was amazing because we don't have any extra weight in your handpiece because it's laser engraved. Is it?
That's right. So that was one of the main advantages on the system because we have no attachment to the handpiece.
Great, great, amazing. Um, is it ready to use? It needs calibration. When it's needed calibration, how could you say?
So some systems require calibration prior to surgery and or a system check in order to calculate the drill length. The drills must be oriented according to the three-dimensional images on the screen. So the surgeon is thus able to prepare the osteotomy and place the implant or the dental implants based on the pre-planned position guide by the prosthesis. So within Alliant, there is no need for calibration, but there is a need for a system check. You just want to make sure everything is well positioned. The sensors are capturing both trackers, the handpiece, and also the patient tracker, and make sure you want to measure the drill length as well. So those are the only things you need to do within Alliant.
So it seems it's so automatic that, but even though it's so automatic, the clinician can abort the procedure whenever he wants or whenever he needs.
Exactly.
What is the level of accuracy? Is it better than placing with static guides or the same level? What do you say?
Okay, so both the static and dynamic computer-assisted implant placement system are more accurate when compared to the freehand approach or guides made on the cast, right? That's independently of the surgeon experience. The freehand approach to implant placement can show a coronal deviation ranging from 1.6 to 2.7 millimeters, apical from 2.4 to 2.9 millimeters, and like a wide range of angle from 7 to 10 degrees. And the results are constant among different surgeons with different degrees of familiarity with the protocol used in surgeries worldwide. So that really doesn't matter the surgeon's experience. Always the 3D printed guided and the dynamic navigation are going to be more accurate. However, there are some studies now that show that dynamic navigation can have an even more accurate implant placement compared to the 3D printed guides. That's something that the literature has been showing now with the latest systems.
Great. It seems so simple to use. Is it possible, for example, is it used only in selected cases or it can be used for undergraduate students? What do you think about that?
So we at Tufts, we have been using this technology a lot. I wouldn't say a lot, so I apologize, excuse me. We have been using this technology with the pre-doctoral students to teach them the implant placement. So we do have an implant elective selective program. So when they are in the last year of dental school, they are able to apply to this program. And those students that get in, they have a chance to practice in the implant placement with the system prior to going to the surgery. And I have a case here to show you as an example. So this is a patient from Thomas Whitmer. He was a D18 student at Tufts. These are the intraoral photos of a patient. We can see that patient is missing tooth number 30. And here is the panel of the patient. So on the conventional way in school, what we do, the students take an outline impression and they do the wax up on the cast, and they fabricate a stent, a surgical stent on the cast. Yeah. And they put a gutta percha, take the x-ray that's needed for the case. But on this program, what we have been doing is before going to the surgery, they have been printing the patient CBCT and having the 3D printed model of that patient that they're going to place the implant. So they mount that 3D printed model, and they have the implant placement simulation using the dynamic navigation system. So here is Thomas Whitmer practicing his implant placement. So he used the same model of the patient, so it's exactly the same patient, right? That's going to do the surgery maybe 30 minutes later.
A perfect replica of patient's condition.
Correct. So it's the same anatomy, right? So it's actually a real patient. So here is his osteotomy of number 30, and here is the implant placed.
Oh, so the predictability dramatically increases.
Exactly.
Great.
Here is another student, Jared Reed, D18 as well from Tufts, practicing the implant placement on a 3D printed model from his patient with a dynamic navigation system.
He's following in real time the inclination and the depth of the implants. Is it the burr?
Correct.
Great.
So he's seeing on the screen the patient's CBCT, and he's seeing the burr moving in real time. And he's going to have that visual where the implant is supposed to be according to his virtual plan, and he'll be able to replicate that on the patient's mouth.
Amazing. It's not about only a state-of-the-art technology, state-of-the-art teaching technique. Great, amazing. Could you tell us, some of the advantages are so obvious, but would you list some of the advantages of dynamic navigation systems over static guides?
Sure. The dynamic navigation allow for direct visualization of the surgical field at all times. I believe this is the main advantage of the system. Is like a freehand surgery because there's no guide, no static guide interfering with the placement site of the dental implant. So dynamic navigation also allows easy access in the posterior region of the oral cavity, such as the second molars, for example, and in patients with limited mouth opening as well. The extension of the metallic tubes in static guides combined with the length of the drills used can be a significant limitation of the static system, right? In addition, the placement of dental implants in narrow spaces, such as in the lower incisors region, can be fully guided by dynamic navigation systems since it is not restricted by the size of the metal sleeve as in the static system. And the dynamic navigation systems are completely open, allowing the use of any dental implant system without requiring any special instruments. Even guides printed by the surgeon require metal sleeves and require specific drills should be used in a predetermined manner. While the dynamic navigation, we can still use the same drills. There's no specific drills for this to be used with the system.
So you can choose, the clinician can choose the implant system at will and use the respective burrs, drills, no specific drills.
Exactly. So it's the same as a freehand surgery. So you can still use the same drills, and you can use any brand, the brand that you usually use in your office. Also, the dynamic navigation system allows for real-time changes to surgical planning. So whilst in surgery, if you decide to change a little bit the position of the implant to be placed, or if you decide to change the diameter of the implant, you can do that during surgery. You can stop surgery, just quickly change the treatment plan and proceed with the new plan.
It's amazing.
Yeah.
Amazing, really. Just for curiosity, do you have an idea how should be the price of the Alliant system?
Okay, so in Alliant is about $34,000 for the system.
$34,000.
That's right.
It's approximately half of CAD/CAM system.
Yeah.
It's reasonably affordable. Reasonably,
Yes.
great, great. At the end of the day, are there any disadvantages of limitations or not?
Yes, as any other technique, we also have some limitations. We have the need of for an additional space in the operating room to accommodate the system's mobile cart. We also have the high cost of the acquisition, which, as you just said, is not that high. But the cost of the acquisition, the constant updating and maintenance can make it financially unfeasible for some people.
Great. In your opinion, what's the future in this research field?
What is the
The
future?
future.
So, in addition to the possible use of dynamic navigation system guiding implant surgery, there are still reports of robot system, which assume that robots are more accurate than humans. There is already an available system for robot assistant implant surgery, the Yomi from UC.
Great. Amazing. Do you have any images?
Yeah, we do have. So just before I show the robot, I just want to mention why I believe the robots are the future, and
Great.
that's because I don't know if you're seeing my slides right now, but we have been using robots already in practical work, like in the car industry, for example, right? And we also have robots in our modern lives nowadays. We do have a lot of those robots cleaning our homes, cutting the grass, as a nurse as well. And here is just something that I wanted to share. Actually, it's a video of a robot that was showed during, I saw this video during the New York Radio Academy of Prosthodontics in 2018. They were talking about the future of the digital dentistry, and they mentioned about this video, and I thought it was funny. Just wanted to share.
Great.
So here they were saying that when they realized that robot was able to hold a vacuum system, the dental assistants got scared because they thought it would be replaced by robots. But then they realized that the robot could actually drill the concrete wall as well. So now the dentist could be replaced as well.
Houston, we have a problem.
Okay, so we actually indeed have robot replacing humans for implant placement, and here is the video from Yomi.
Neil has pioneered the first robotic-assisted guidance system for dental implant surgery, called Yomi. It provides dynamic planning software that can be changed at any time, real-time visual guidance so the surgeon can confirm their progress, and physical guidance through a collaborative robotic arm, with real-time patient tracking throughout the surgery. The procedure starts with a CT scan of the patient. The surgeon plans the surgery, accounting for key anatomical features like the nerve, sinus, and adjacent teeth. Yomi achieves physical guidance through the use of haptic robotic technology. It physically constrains the surgeon's drill movement to match the plan. As soon as planning is complete, Yomi is immediately ready to assist the surgeon in carrying out the surgery the same day. Yomi's real-time visual guidance works like a GPS system. The surgeon always controls the drill. When the surgeon is close to the target, Yomi guides the surgeon into the precise angle and position. Yomi prevents any deviation from the plan. With full view of the surgical site, the surgeon precisely drills the osteotomy and is stopped when reaching the planned depth. This enables a minimally invasive, flapless approach, which can lead to faster surgery, faster recovery, and less pain for the patient. Through seamless integration into the surgeon's operating environment, Yomi achieves a truly digital dental workflow. Yomi, Accurate guidance through robotic assistance.
Let me ask one question, Dr. Thaisa. In addition to paying for the system, what should be the dentist's work in this case?
Yeah, so here actually with Yomi, the concept is very similar to the dynamic navigation. However, we have the sensors as well. However, the dentist here has a passive action here. The dentist is actually just controlling and just observing the procedure and make sure everything is going the way it should go. So it's basically passive action in the robot.
He just interacts during the planning, approving the planning and clicking and saying to the system that he can goes on.
Correct.
Great. How much it costs?
So this system actually costs much more. It's about $150,000 if I'm not wrong. So that's one of the main disadvantages of the system. Is definitely not as feasible as a dynamic navigation system.
Is it still a prototype or is it commercially available?
So this system is also available to be used clinically already, but I do believe there's still a lot more study to happen with the robot systems, and also the technology still has to improve, as has been happening with so many other technologies. So hopefully in the future the price can drop and that will make it more affordable.
Great. Oh, so that's it. We are coming to the end of the interview. I don't have words to express my gratitude for your availability and for your participation in our book. Your chapter was amazing, and because of that, the book reached over 20 countries, even though it's published in Portuguese. I'm so happy to tell you that. And I'd like to say thank you as well, because I've heard that your the professionals at your university have been doing a great work during these hard COVID times, and I hope that it's coming to an end,
Yeah.
and it's going to be better as soon as possible. But thank you very much for the great job you're doing in your community as well.
Thank you so much. Thank you to Dr. Fabio Andretti. Thank you so much for having me. It was an honor here to be here with you.
Great. Thank you very much. Bye.
Thank you.